I was originally diagnosed in 2010. In the fall of 2010, I was a young mother working full time. I had children 4 and 6, very busy, very healthy, training for a half marathon, and had some pretty intense pain in my abdomen. Went to the ER, was quickly found to have multiple tumors in my liver, and those were biopsied. I was initially misdiagnosed, which is, I know, very common with angiosarcoma, but that was corrected to EHE, and we started looking for treatments. Found out quickly that there were none. Started a couple kinds of chemotherapy that did not work, and my situation deteriorated very quickly. The tumors in my liver were very aggressive. They filled my whole liver. I also had tumors in my lungs that were stable. But because of those lung tumors, people did not want to consider transplant. So we really had to fight for that, but did end up going in that direction. And UCSF was willing to do a living donor liver transplant. And in February of 2011, I had a successful living donor liver transplant, which was amazing. And within 6 months of that, I was back on my feet, strong, capable of going back to work, joined a women's soccer team, coached both my kids' teams, back at it. So it was a crazy year. And then, we really felt like we'd gotten through it. And I still had the multiple nodules in my lungs that were stable and that needed monitoring. But we had gotten through what we, thought was the worst of it. Post-transplant, I started on first sirolimus and then everolimus, and have been on those consistently up until recently throughout the course of treatment. And the nodules in my lungs, we've simply scanned, originally every 3 months, then every 6, then every year. And I went, I want to say 8 or 9 years pretty safely, very healthy, felt better than I had in my whole life. Really doing well. And after about 8 or 9 years, I started to get growth in my lungs. And we did really aggressively manage that. The initial thing we did when several of the nodules in my right lung were growing aggressively is go in and have those taken out through a VATS procedure, video assisted thoracic surgery. So I had surgery on my right lung. And I had an added complication that just sort of led to some other complications later down the line of having a congenital heart issue, familial, that had to also have surgery at that time. And then that handled the right lung for a while, and then the left lung started up. So about a year and a half after that, I had another VATS procedure in my left lung, taking out multiple little small resections of the lung. Following those 2 procedures, another tumor started getting a little aggressive. And so we tried radiation, targeted stereotactic radiation, which worked well on that, but did cause some scar tissue in my lungs. Following radiation, we had some stability for a while, and then started having overall growth again. And at that time, my oncologist and I decided it was time for a more systemic treatment. So we tried chemotherapy, and I did a course of Doxil, which is sort of a milder doxorubicin. And that was, I didn't tolerate it very well, but it did a good job of stabilizing things, but it further damaged my heart. So again, not related to EHE, but I have this sort of side issue going on with my heart. That ended about a year ago, the doxorubicin, last summer. And I've had just sort of a series of infections and complications with my lungs that have led to needing oxygen, and a lot of different medications and other things, and we're a little bit stumped. So, right now I'm in kind of a exploratory phase of dealing with both oncology and pulmonology, trying to figure out why I am not getting sufficient amounts of oxygen, and they're not sure what the primary driver is, or a combination of the two. Is it my cancer sort of taking over the airways and preventing my lungs from oxygenating the blood, or is it something in my lungs themselves, further infection, some new interstitial lung disease? They really don't know. And so we're continuing down a long and very frustrating, full of unknowns path of trying to get me breathing again. Following chemotherapy, I developed an infection and my kidney numbers were a little bit off. And so they took me off of the everolimus for about a 3-month period. At the conclusion of that 3-month period, I was scanned and we found that there were metastases that had formed in my bones, in my pelvis and my femur and lower spine, and on my scalp and my skin. Don't know if it was because I went off the everolimus or not, but my oncologist promptly put me back on. But the bone metastases were incredibly painful. I also have pain in my back along my scapula and in my ribs and chest that is pretty severe. So I am also for the bone pain, I did have an additional course of stereotactic radiation on the 2 largest tumors, and that helped significantly with the pain. That's being very well controlled. I've also been referred to the pain management clinic at UCSF at my hospital, and I'm working with them on pain medications and other therapies to really try and handle and manage my pain. But it's difficult. I have some nights where even the morphine and the other opioids layered on each other don't work. Last night was one of those nights where I couldn't beat it, so that has been it adds a layer of stress and just sort of exhaustion when you have chronic pain. And so that has been difficult, almost as difficult on my family as on me, because they hate seeing me suffer like that. So I don't have any answers for that. There is nothing in my scans to account for the pain or where it is. And the best that the doctors can think is that it's referred pain from tumors along my lower lungs hitting my diaphragm and causing pain to come up through my back. But nobody is, again, we don't really know. It's this bizarre thing, and it's excruciating. It feels like there's literally a knife in my back, and it's there almost all the time to some degree. So it's just bizarre. And I am working on and trying courses of steroids as well to work on inflammation, which is a risk for a transplant patient because it can lead to infection. So I'm also taking antibiotics to prophylactically prevent further lung infections while I still have a lung infection, but I'm also on steroids. So it's this very delicate balancing act. But the steroids have helped with the pain as well. I would take us back 3 years ago first. 3 years ago, when I really felt like I was on top of this, and this was something that I had gotten the better of. I had gotten the better of EHE, and I was going to be just fine. And I was making plans for, my husband retiring and where we were going to settle, that the kids would want to come visit. Would there be room for grandkids? We were thinking we're going to be empty nesters this year, really thinking in those very long-term plans. And now I was reminded that we just never know the course of this, and EHE can change its course on you at any time. It's really unpredictable. My daughter is about to start college in August, and I am really, really hoping that I'll be able to be there to move her in, just be physically capable of being present. So it really does shift your priorities and your way of thinking. And I've had to make some pretty big adjustments. Yeah. I think I would remind myself back then and throughout the course of this journey how important it is not to take feeling good and your stability for granted. This is an insidious disease, and it is unpredictable, and you may have long periods of stability, and then it can come back. And so it's just really important to be vigilant, to stay conscious about, your situation, and to continue to fight along with the rest of us for treatments and a cure, to do what we can to spread awareness, to raise money, hold events, all of these things that can help the foundation provide research grants and hopefully make more progress. Um, I would just say that I would tell myself to stay vigilant and not get complacent. Right now, it is the most important thing to me and to my family, and it is the thing that we think is most significant to focus on. I have undergone a wide variety of treatments over the last 13, 14 years, and I'm getting to a point with my oncologist where we're talking about what is left in the toolbox. And I can tell you that there's not much. I feel like our resources of things that we can try are really running out. And I am looking at the work the foundation is doing with all of our amazing partners and just praying that one of these things comes through and puts another tool in the toolbox for all of us, right? Yeah. So to me, research is the most important thing we can do. Personally, I cannot think of a better use of my time or resources than supporting the work of the foundation. We are doing everything that we can to progress both research and patient support. And I just think that there's no more valuable use of my time. The research is what is going to lead us all to treatments and a cure that allow us to have the long, fulfilling lives that we envisioned. Um, and patient support is incredibly important in a rare disease like this, where we're alone. Nobody can give us answers. There is no clear path forward. So the support that we can provide to people who are facing this for the first time, I think, is really critical. So it's an honor to be involved with this foundation. It really is. I would just say, to those younger patients, first, what a different position they're in than when I was diagnosed at 38 with very young children. There was no EHE Foundation. There was no consensus paper, all of the amazing tools that we have now to help navigate the initial stages of a new diagnosis and making decisions regarding treatment. And just what a wonderful position we're in, relatively speaking. And again, not to be complacent with that, but to continue to move that bar forward. Because we have this foundation, now we can focus on the big stuff. We can focus on research, we can focus on cures, we can focus on, supporting these scientists that are trying really hard to figure out a way to control this disease. So, I think we're in such a better place, and we can continue to move that ball forward and make progress, and just hope that they'll be involved with the foundation, be involved with your own care, because that's the way we all move forward together. It's really easy to donate tissue to the biobank, and anytime you're having a procedure. For my VATS procedures, I did submit tissue samples, and also went all the way back once we developed this, and sent some of my liver samples to Cleveland Clinic as well. So there's lots of ways and that you can contribute to research that aren't financial, that are tissue, that are filling out the surveys that we send, all of the things that come out from the foundation are ways that you can get involved and be proactive in your own care. And then the scientists are looking at information that is directly relevant to you. And not only are you paying it forward to help other people that are diagnosed in the future, but your own biology is being taken into account as we're fashioning, treatments and a cure. So it's just so important to stay involved, be involved in research, be aware of what's going on. And I would say that's a wonderful way that all of our new patients can help. My moonshot hope is that we find a cure. But I would be thrilled if we could find a treatment that allows people to just live a fulfilled, healthy, active life, and stops progression, stability. I just think with this disease, if we can get stability, we're good, right? Stop progression and allow people to just live a normal, active life. That would be my dream. in order to get the research that we need done, we need to support it financially. There's just no other way to make this happen. In rare disease, we simply do not have access to the same types of outside funding that more common cancers have. And so we have to take charge and do it ourselves. And so the foundation's work and development, from the individual who can offer $5 to a large foundation that might be able to offer us multitudes of that, we have to look for every single contribution, because the only way we will fund this research is if we do it ourselves. And the only way we will find treatments and a cure is if we fund this research. So it really is on all of us in this community to make this happen. We are our best shot.